All right, this is the third and final PowerPoint that goes with content PCH 3.2, first aid, CPR. So this is advanced CPR and a PowerPoint based on other common emergencies like bone and tissue, muscle and tissue injuries, impaired consciousness, animal bites, nosebleeds, and poisoning. So we have several vocabulary words this time: fracture, dislocation, unconsciousness, concussion, poison, poison control center, and venom. So when you have a muscle or joint injuries, of course, they can be something as minor as like rolling an ankle, as severe as to breaking something, dislocating something, tearing or straining a muscle. So of course, it depends on the severity whether you will need medical attention or not. A strain is a tear in a muscle. A sprain is an injury around the ligament of the joint. So that is the difference in a strain and a sprain. And of course, they can be minor or they can be, of course, major. They can be minor where you can walk it off, be fine. You'll be fine in a few days, as to needing to have medical attention and staying off of like the injured body part for days or even weeks. So they can vary in severity, and of course, depending on how severe they are, will depend on if you need medical attention. So if emergency is, you want to seek emergency help if the victim is unable to move the affected muscle or joint, the pain is severe, the injury is bleeding, the joint appears to be deformed, or you hear a popping sound coming from the joint. Of course, to treat minor strains and sprains, you're going to use the Price procedure, and that is protect the affected area, rest the injured body part for at least a day, ice the affected area for 10 to 15 minutes at a time, 3 times a day to reduce the pain and swelling, compress the affected area by wrapping it firmly but not too tight, and then elevate the injured body part above the level of the heart if possible. So fractures and dislocations are, of course, a fracture is a break in the bone, and dislocating would be dislocating like a joint. Is the separation of its bone from its normal position in a joint. That's what a dislocation, and of course it's going to require immediate medical care. The first aid procedures, of course, call 911 or your local emergency medical service. Keep the victim safe, still, and calm, and if the skin is broken, rinse carefully in the infection and don't disturb the bone. Then, of course, if necessary, apply splint to immobilize the injured body part to prevent further injury. Apply an ice pack to reduce pain and swelling. And if the injury does not affect the head, neck, or spine, have the victim lie down and raise his or her legs for about 12 inches to prevent shock. When someone is unconscious, you're going to need to give them emergency medical help. And being unconscious is the condition of not being alert and aware of your surroundings. So follow these 3 steps. If they are unconscious, call 911, check for breathing, and be prepared to perform CPR. If the victim is breathing, does not have an injury on the spine, lay the victim down in the recovery position on their sides, as you can see in the picture. Fainting is a temporary loss of consciousness that occurs when not enough blood is flowing to the brain. If a victim of fainting should see a doctor as soon as possible if they have never fainted before or they are fainting frequently. Anyone who loses consciousness or experiences memory loss or confusion because of a head injury might have a concussion. And a concussion is a jarring injury to the brain that can cause unconsciousness. So if a concussion, they range in severity as well. In severe cases, you want to call 911. If the victim is conscious, have him or her lie down and use first aid to treat any bleeding while you wait for help to arrive. And of course, if the victim is unconscious, avoid moving him or her, because they may be a head or neck injury. And of course, if otherwise, place the victim in the recovery position. This is information about animal bites, nosebleeds, and poisoning. So this is what to do in those situations. Of course, animal bites can transmit serious disease such as rabies, a viral infection that can be incurable and deadly if not treated immediately. A tetanus booster shot may be required for any bite that breaks the skin, and even a rabies shot. Of course, What to do for animal bites: wash your hands thoroughly and put on protective gloves. Wash the bite area thoroughly with mild soap and water. Apply pressure to stop any bleeding. Apply antibiotic ointment and a sterile dressing. And of course, if the wound swells, apply ice and a towel for 10 minutes. For nosebleeds, you want to sit down and squeeze the soft part of the nose between your thumb and finger, holding the nostrils closed. Breathe through your mouth and lean forward to avoid swallowing blood. An ice pack or cold compress applied to the bridge of the nose may also help. And of course, if the bleeding doesn't stop after 20 minutes, seek medical help. For a poison, of course, it could be a solid, liquid, or gas, and that is any substance that causes injury, illness, or death when it enters the body. And of course, in the first step of any suspected poisoning is to call the Poison Control Center, and that is our round-the-clock service that provides emergency medical advice on how to treat victims of poisoning. The poison control expert will ask you lots of questions and step-by-step instructions to how to treat the victim. Of course, don't give any medication to the victim unless that expert tells you to do so. Next, we're going to talk about a snake bite, and that is certain types of snakes can inject venom into the victim's body, and venom is a poisonous secretion by the snake. And of course, anytime there's a snake bite, call 911 for medical help and follow the dispatcher's instructions. Try to keep the victim from moving. Keep the affected body part below chest level. Remove rings and other constricting items for swelling. Use a snake bite suction kit if one is available. And of course, for insects, spider bites or stings. Stings of insects like bees, hornets, and wasps, as well as other certain spiders, are very painful, but a lot of times not dangerous unless someone is allergic. So if someone is allergic to the venom of these insects or spiders, 911 may need to be called because they could go in anaphylactic shock. So what to do for spider bites, insect bites, and stings: remove the stinger by scraping it off with a firm, straight-edged object. Do not use tweezers since it may cause the stinger to release more venom. Wash the site thoroughly with mild soap and water to help prevent infection. Apply ice wrapped in a cloth to the site, alternating 10 minutes or the 10 minutes off, 10 minutes on, 10 minutes off to reduce pain and swelling. And of course, poisonous plants. So a lot of people are allergic to poison ivy, poison oak, and poison sumac. Exposure to these plants causes itching, swelling, redness, burning, and blisters at the site of contact. So what to do if you come in contact with a poisonous plant? Of course, if you brush up against the poisonous plant, don't rub your skin. Wash the area immediately with soap and water to prevent a reaction. Wash any clothing or other objects that have touched the plant, and an over-the-counter cream or oral antihistamine, of course, can ease the itching. So exposure to poison ivy, oak, and sumac can cause swelling, itching, and blisters. So depending on how severe they are, hopefully when you come in contact with that, if it's not so severe, you can deal with it on your own, and it will heal on your own. But if it's not healed on its own and you are severely allergic, it may require medical attention and getting steroids. This concludes all the information about first aid. Just make sure you have reviewed all 3 PowerPoints because you will be responsible for these 3 PowerPoints on the test.